Hey guys, Max here, and I am 3 weeks post-op top surgery. So I thought I'd do another video real quick to kind of talk about it. So I'm just gonna start off right off the bat and show my chest at 3 weeks, so you can see where I'm at. Sadly, I've gained quite a bit of weight since the surgery, so I'm kind of tubby. I've gotten a little bit chunky, so it's kind of sad. I've gained like 15 pounds since the surgery. I'm planning on getting to work out a little bit. Like, I'm not gonna push it. Don't worry, guys. Don't freak out on me right now. So, like, I went to the doctor on Monday, so that was 2 days ago, and she said that it was healing really nicely. Everything looks really good. So I was able to, like, I don't have to wear the vest anymore, so I can finally just put on a t-shirt. I don't have to cover it up. I don't have to put gauze on anymore. Um, this one nipple on the right side, I have a little bit of a kind of a hole, I guess, from the dead skin coming off. So she told me to just kind of put a band-aid on it. So I figured I'll do that after my video. Just a little tiny bit of Neosporin and just cover that up. But for the most part, everything seems to be healing up okay. I did have a lot more skin than she had anticipated, and my skin wasn't as elastic as she was hoping. So I do have under the arms here a bit of extra skin. I guess mainly it was this side, the right side. You can see that it kind of bunched up skin there. She was saying she may have to do a little bit of a revision on that side. We'll see how it goes, how it heals up. I'll be going back in 3 months, or well, in 2 months. I'll be going back in 2 months, a little over 2 months for my 3 month post op, so that we'll take some after photos and see how it's going. And she may have to do a little revision, but she said she could do that just in the office, just kind of pull off that little extra skin that she had a bunch up. Um, Sorry, I lost my train of thought there for a second. Anyway, I wanted to do a video to talk about just some of the things I'd noticed during this process that I thought was interesting between surgeons. I've heard a lot of other surgeons, they say that you have to not take your injection like the week before your surgery, or like you have to stop your hormones before surgery. Dr. Agarwal didn't have me do that. She said even if my day, like the time for my injection was the day of my surgery, the morning of my surgery, that I could do my injection right before going into surgery. So I haven't had to stop hormones at all to have my top surgery. Also, I am a smoker. I know, it's horrible. Don't give me the lectures. Smoking is bad for me. I do not condone smoking. I don't think it's a good thing. I wouldn't have anyone start smoking. I know it's killing me, but it's a lot harder to just quit than people think. Like, I don't know, it kind of helps me get through the day. And so I know a lot of surgeons will not operate on you if you haven't stopped smoking. But my surgeon knew that I'm a smoker. I told her how much I smoke, and that didn't seem to be a problem. And they suggest not smoking up to 10 days after surgery. But I'm horrible, and I did it anyway because it's not like I sit and chain smoke. I'm not smoking a pack a day. I'm saying like 3 or 4 a day tops. So I was still smoking after my top surgery, and honestly, I think it turned out pretty well. I mean, yeah, the scars haven't, like, you still have the incisions here, so you don't have a lot of the scarring yet, so it's not turning red yet for the actual scarring. But I really think that it turned out really good. Like, I'm really stoked about how well it's turned out. Um, anyway, I just thought I'd put that out there that, like, for those of you who do smoke, like, okay, if you want to quit and you have the willpower to do it, I would say do it. Quit smoking. If you can do it, quit smoking. I don't have that willpower. As much as I wanted top surgery and as much as I wanted this to happen, I just don't have that willpower quite yet. I haven't gotten to that point in my life. And so I'm just saying that there are options. Like, you can still get it done, and you're not going to lose your nipples. You're not going to screw up your entire top surgery because of this. Just putting that out there. Other than that, to reiterate, going back to my surgeon, right now we got to the point where she told me basically just to massage the scars to help break down tissue, to kind of flatten it out. So once or twice a day to go through and just kind of massage all the scar tissue along the incision. And I can start using like tissue repair creams, scar creams, etc. However, I was asking her opinion on what kind to use, what would be the best kind of scar treatment to use. And she said that honestly, with all the stuff that's out there, none of them are actually guaranteed or proven to work on scars to make them diminish. Like, with top surgery, there will be scars. There's no way to avoid being scars. You can try to lighten it up, but the scar creams, none of them are guaranteed to work. There is nothing to scientifically prove that any of these scar creams out there will get rid of the scars. So basically, she suggests, like, if you have it, use it. She said if there is anything guaranteed to work, she would prescribe it to her patients, but they're not. So I'd already bought in a little thing, a scar cream, so I will end up using it just because I have it. But she said the main thing that helps the most is massaging those areas. Like, you don't want to just like lightly rub it. You have to actually kind of like actually get in the tissue and rub it. You want to put some pressure on it, but like not so much that it hurts, but enough that you can feel that you're actually working it to try and flatten it out. And I really think that it has flattened out quite a bit since um, just the past couple days that I've been massaging it. I think a lot has happened. And like, you can see the little scar right here and my little scar on the other side here where my drains were. They're a lot lower than I thought they were going to be. I thought they were going to be a bit higher, but... And I do have some swelling still over on this side, and it's a bit puffier than the other side, but she said that a lot of that swelling should go down. So we're just going to see what happens. Anyway, I'm not going to make this video too much longer. If anyone has any questions, find me on Facebook, comment, ask, and I guess I'll catch you on my next update video. Thank you guys. Bye.